Historically, as a result of intersecting racist, sexist, and classist oppressions, Black women in the United States have faced disproportionate, severe, and unique threats to their health. We will be examining various areas of Black women's health and the ways systemic oppressions have caused deficiencies in those areas. One aspect of African American women's health which has been negatively affected by systemic oppression is nutrition. Black women's access to varying and nutritious foods has been limited since the enslavement of Black people in the United States. In his documentary entitled Soul Food Junkies, Byron Hurt explains that slaveholders wanted to provide their slaves with foods that fueled hard labor and kept them alive, but they also wanted to minimize cost. As a result, they allotted provisions which were high in calories but lacking variety and nutritional content. Some of the common foods consumed during the enslavement period, for example pork, lard, and cornmeal, remained important in the diet of many African Americans. These dietary traditions would later be referred to as soul food, and many of the dishes cherished as a part of this tradition remained high in fat and calories and low in other nutrients. Although the foods which are part of the soul food tradition may pose a threat to Black women's nutritional health, Hurt, Chung and Myers, and Franceschini and colleagues have argued that the broader causes of nutritional health disparities among African American women are widespread poverty and lack of access to affordable, nutritious foods. Chung and Myers found that chain stores are less likely to be present in low-income urban communities, and many African Americans in these communities are forced to shop at higher-priced small grocery stores or convenience stores. As a result, Franceschini and colleagues argued that in many low-income communities, fresh fruits and vegetables are unavailable or too costly. The outcomes of these inequalities in food distribution include higher rates of obesity among Black women compared to white women, as demonstrated in Johnson and Lee's study. According to Artigo, Rodenas, and colleagues, obesity is associated with other adverse health effects including hypertension, diabetes, cardiovascular disease, and mortality. Studies by Anderson and colleagues and Bethia and colleagues suggest that African American women experience higher rates of obesity not only as a result of lack of access to nutritious foods, but also due to stresses caused by poor housing conditions and daily experiences with racism. Another area of health in which Black women have experienced persistent and severe challenges is reproductive health. During the enslavement period, Black women's access to pre- and postnatal care was limited. White described how some enslaved Black women attempted risky abortions with the help of other women. Problems affecting the reproductive organs, including amenorrhea, abnormal bleeding, abnormal discharges, syphilis, gonorrhea, and uterine infections were common. White also described many pregnancy complications which enslaved women suffered, including convulsions, retention of the placenta, ectopic pregnancy, breech presentation, premature labor, and uterine rigidity. Widespread poverty and lack of access to medical aid make many Black women vulnerable to poor reproductive health in modern times. Bound and Geronimus found that African American women experience higher rates of hypertension and anemia, which are associated with various problems during pregnancy and adverse birth outcomes. A study by Dominguez found that infants of African American women are more likely than those of any other ethnic group to die or to be born with preterm or low birth weight. Black women are more likely than any other ethnic group in the U.S. to experience unplanned pregnancy and abortion, according to Dellendorf and colleagues, and lack of access to safe, affordable abortion procedures puts them at risk. Daniels and colleagues described many obstacles which stand in the way of effective reproductive health care and prenatal care for African American women, such as insufficient finances, lack of nearby facilities, lack of education about appropriate reproductive care and prenatal care, racist treatment by healthcare staff, and distrust of medical professionals. Studies by Becker and Sue, Grail and colleagues, and Bridgewater and colleagues have shown that Black women seeking reproductive health care are more likely to be questioned about their drug use, less likely to receive information about certain health options, and more likely to be pressured to use contraception or engage in family planning. Experiences with discrimination during pregnancy have been shown by Earnshaw and colleagues to cause depression and anxiety symptoms in African American women, which can adversely affect reproductive health. As explained by Ritchie, mass incarceration and institutional violence also have damaging effects on the reproductive health of Black women. Racism, classism, and sexism interact to create situations in which poor Black women are criminalized, imprisoned, and brutalized by law enforcement officers and prison officials. Mass incarceration threatens reproductive health through sexual violence and poor treatment of imprisoned pregnant women. In Asada, an autobiography, Asada Shakur describes how she was treated when she was pregnant with her own child, saying, "I was taken to Roosevelt Hospital and shackled to the bed by my foot. After 10 days, I was discharged from the hospital over the objections of my doctor, brought to the Middlesex County Jail for Men, and kept in solitary confinement from February 1974 until May 1974. Another area of health in which Black women have experienced persistent disadvantage and harm is mental health. Since the enslavement period, African American women have lacked access to institutional forms of mental health care. Anecdotes from Mrs. Amanda Smith and Friends of Freedom suggest that Black women have turned to other coping strategies, such as social support and religious faith. Vanessa Jackson, an African American counselor, has argued that racist, sexist, and classist oppressions create climates in which Black women's mental and emotional well-being are constantly attacked. In addition, the unique stereotype of the strong Black woman creates the perception that Black women do not experience physical, mental, and emotional distress. The stresses caused by interpersonal racism and sexism, combined with the stresses of poverty, environmental degradation, poor nutrition, the threat of various forms of violence, marginalization from all aspects of the political process, and other mechanisms of oppression, can severely harm Black women's mental health. The accumulation of stress, caused by various forms of oppression, may contribute to higher rates of obesity, hypertension, diabetes, adverse birth outcomes, advanced aging, and the development of psychological disorders. According to Dr. Suzette Spite, many African Americans have negative experiences with paternalistic and white-dominated social service professions, such as counseling. Spite argues for the need to re-examine boundaries in counseling and to encourage greater empathy and solidarity between clients and counselors.
A pressing matter in the health community is the persistent lack of clinical data on African Americans, specifically women. This is due to African Americans' tendency to avoid participating in clinical studies. It seems that the medical community is perceived as untrustworthy by many African Americans. A study conducted by Corby Smith, Thomas, Williams, and Moody Ayers on 33 African American adults found that mistrust of doctors, scientists, and the government was reported consistently by the participants. This mistrust is rooted in historical health injustices carried out on African Americans, specifically women. The mistrust of medical professionals and institutions by African American women is examined in the work of Bupong, Gorelick, Harris, and Samuels. In the article, the writers claim that a historical review documented past medical experimentation and other practices on blacks that were often brutal and unethical. There are many examples of these unethical medical practices on the black population, but the one that most often comes into mind is the Tuskegee syphilis experiment. The Tuskegee syphilis experiment was the purposeful infection of many black men with syphilis to study its effects. Although those who were infected were men, this experiment affected African American women by setting up a sense of distrust. According to Gamble in his article, the Tuskegee syphilis study continues to cast its long shadow on contemporary relationships between African Americans and the biomedical community. While the syphilis experiment is probably the most infamous case of medical injustice, it is far from the only example. A prime example of medical experimentation carried out on African American women is the case of Sarah Bartman. Bartman is an example of a fascination with black females' health and sexuality. Netto, 2005. Promised wealth and fame, Sarah Bartman was tricked into captivity where she was treated like a zoo exhibit. While in custody, Bartman was the victim of harassment and unethical living conditions because of her defining feature, her large buttocks. In his article, Qureshi recalls the conditions of private viewings of Bartman, which read, "Parties of 12 and upward may be accommodated with a private expedition of the Hottentot. A woman will attend, if required." While Bartman's life was an example of medical injustice, her death was even more so. After her death, instead of being given a proper burial, Bartman was dissected. An article written as recently as the year 2000 states that La Venus Hottentot lives in Paris, in the Musée de Leon, as a detached genitalia floating in a formaldehyde jar in a repository now hidden from general viewing. Her dissection was a manifestation of the past belief that black women were drastically different biologically than other women because of their black skin. This belief was the driving force behind most instances of medical injustice. A somewhat lesser-known instance of medical injustice, but one that affected a much greater scope of people, was the influx of involuntary sterilizations of many minorities, including African Americans. In the past, Stern claims that government and medical institutions defined sterilization not as punishment, but as a prophylactic measure that could simultaneously defend public health, preserve precious fiscal resources, and mitigate the menace of the unfit and feeble-minded. Of course, the unfit and the feeble-minded include just about every ethnicity except whites. These sterilizations were carried out without consent, usually during hospital visits for unrelated things. There were many contributing factors towards the non-consensual sterilization of many African American women, one of which was the eugenics movement. As stated by Ludmer, discoveries with genetics supplied geneticists a mode of expression to invoke their already existing social concern by providing new vocabulary with which to present eugenic proposals. This statement is saying that the influx of genetic information was used as a weapon by eugenicists to justify their own prejudices against minorities. The most troublesome aspect of the eugenics movement was how it was supported by multiple institutions. Not only was the medical field carrying out sterilizations, but other institutions, such as the government, were involved. The most infamous example of an institution that supported eugenics is the Planned Parenthood institution. Smith claims that the historical origin of Planned Parenthood are inextricably tied to the eugenics movement. Indeed, some of the higher-ups of Planned Parenthood were known supporters of eugenics. Planned Parenthood, however, was not the biggest institution involved with eugenics, nor was it the most problematic. Those titles belong to the United States government itself. According to Lombardo, every president, from Theodore Roosevelt to Herbert Hoover, was a member of the eugenics organization, publicly endorsed eugenic law, or signed eugenic legislation without voicing opposition. Looking at the multidimensional involvement of many institutions justifies the African American community's general distrust of doctors, Planned Parenthood, and the government. African American mistrust of medical professionals, the government, and family planning organizations is a justified belief that has been founded on historical instances of injustice. In addition to the Tuskegee syphilis experiment, there were many cases of unethical medical practices that targeted women. The case of Sarah Bartman is one that perfectly frames the obsession with a black woman's body, both sexually and medically. Furthermore, the non-consensual sterilizations carried out on many African American women can only be described as an attempt at genocide. Finally, the eugenics movement further pushed the notion of attempted genocide, so much that it inspired some of the Nazi ideology. These instances of medical injustice, among countless others, are the foundation of African American women's mistrust of many medical and health-related institutions. African American women's health has been negatively affected in many ways by many oppressive systems. Poverty and lack of access to nutritious foods have resulted in adverse physical health conditions. Black women's reproductive health has been threatened by sexual violence and a lack of access to reproductive health care and parental care. Institutional and interpersonal racism and sexism have caused ongoing stress, which has negatively affected many black women's mental health. Combined with mistreatment at the hands of medical professionals, these factors have dramatically reduced black women's trust in healthcare systems and have had a unique negative effects on their health.